join our health workforce, helping us every day. I welcome you all on this Foundation Day, which is 12th of January. We celebrate every year, and I am really lucky to be celebrating this as my third time. Uh, any Foundation Day, why do we celebrate Foundation Day? You know, this is the occasion where we should be committing ourselves that who we are, what we should be doing, and we should be taking to the greater heights what we are supposed to do. We are supposed to achieve academic excellence. We are supposed to perform a cutting-edge research. We are supposed to be delivering a good clinical care. We should be relieving the pain and sufferings of the patients and the needy people. At the same time, being a tertiary institute, we got a greatest responsibility of capacity building, producing the modern doctors who are really very well educated, good in their integrity and excellence, their capabilities and their skills, a good nursing officers, and the complete health workforce required to run any hospital. It's really a great day. It's a day to rejoice. It's a day to reform. It's a day to take our commitment to the further heights. And this day particularly belongs to the students, because the students are the heart and soul of this particular institute. And I'm sure in coming years, you will be contributing more in your learning, in your achieving the skills, in having a modernity and healing to the needy patients. And also the faculties who are the torch bearers of this institute, who are the guiding factors, their commitment in with their advice, with their dedication, I think this institute will take a greater heights. At the same time, our health workforce who complement us, whether it is the security, whether it is the conservancy staff, whether it is the managerial staff, whether it is the administrative staff, I think everybody has got an immense contribution running this particular machine. And we are really very lucky to have one among us, Dr. Sareen sir, who is a known hepatologist in India. He's been working tirelessly for so many years. He's our Shanti Swarup Bhatnagar awardee. And he's Padma Shri also. Sorry for that fiasco. I don't know who started the music. It's okay. I was just going through the biography of the sir, and as far as citation goes, I'm probably 8,000 behind. When it comes to the publications, probably I'm again, I think 900 behind. Though I'm little 8 years younger to him, really the kind of contribution he has made to the medical industry, to the care of our society, and especially in India, developing a center of excellence which is recognized by World Health Organization. Sir, we owe you and we respect you, we love you a lot, and that is why I thought Sareen sir will be the very appropriate person to address our students. So dear students, faculties, our health workers, please commit yourself that we are going to serve the humanity in a better way. We are going to take greater heights for this institute by dedicating ourselves, by innovating, assisting in surgeries, giving good clinical care to the local communities. That is what I have to say about. Thank you very much.
Thank you, sir, for those inspiring words. Next, the highly anticipated event, the Institute Day Oration Lecture. It is with great privilege that I introduce our distinguished orator for the day, Padma Bhushan, Professor Dr. Shiv Kumar Sarin. Professor Shiv Kumar Sarin is the Professor of Eminence, Department of Hepatology, Chancellor and Director, Institute of Liver and Biliary Sciences, New Delhi. He was instrumental in setting up the Institute of Liver and Biliary Sciences under the auspices of the Government of Delhi. He is the Director, WHO Collaborating Center on Chronic Liver Disease and Viral Hepatitis at the Institute of Liver and Biliary Science. He also serves as adjunct faculty, molecular medicine at Jawaharlal Nehru University due to his deep interest and contributions to translational science. He is credited with several new treatment protocols for liver diseases. He has several publications and books to his credit. He has helped develop 21 major guidelines, including 6 major Asian Pacific treatment guidelines in liver diseases. Professor Sarin has shown leadership role in being the president of the National Academy of Medical Sciences, Indian Society of Gastroenterology, Indian Association for the Study of the Liver, Asian Pacific Association of Liver, and Chairman Steering Committee of the Asian Pacific Association of Liver. He has been awarded the prestigious Henry L. Bakers Medal 2017 by the World Gastroenterology Organization, as also the Ralph Corn Memorial Lecture at the Institute of Hepatology, London, Professor Telfer Raylan Memorial Oration at the University of South California. He is also a recipient of Shanti Swarup Bhatnagar Award and many more. He developed with other Board of Governors the Vision 2015 document for medical education in India during his tenure as Chairman of Medical Council of India. We are incredibly fortunate to have him here with us today. With this word, I invite Sir for the Aiims Guwahati Institute Day oration. Sir.
A happy birthday. I thought when you have happy birthday, people call whistles and all that. No? No whistles? I thought this was the students, faculty, and all the staff of Aiims Guwahati. I bring greetings and I want to thank Dr. Ashok for inviting me. I was enamored by the 200-acre piece of land and the new creation that you have done. And I want to share some thoughts. I'm told you are 394 MBBS students now, and many PGs, and 109 faculty members or so. All right, to all of you, one more time, a very happy birthday. So that's the cake. Imagine you are eating it. I will try and talk to you as if I have entered a medical college. Is that a good idea? Yes, sir. All right. So I will be asking you questions as if we asked our friends. And you have to answer yes or no. Is that all right? Yes. So now this is an interactive session on pathicalism, and I know you don't know this word. I have no disclosures. Now this is what I feel. I have come to medicine. We doctors face maximum scientific, social, moral issues every day. मरीज आया, ज़्यादा बीमार है, या चाय पिएं कि उसको पहले देखें, बड़ी मुश्किल. And physicians and diseases, they don't have any religion. कि भाई अब नमाज का समय है या पढ़ाई का समय है या भूख लग रहा है, कोई मतलब नहीं. Is that right or wrong?
Yes, sir.
So say right. Now the first question, why, for the students, not faculty, why are you doing MBBS? पिताजी डॉक्टर है, इनहेरिटेंस, रेज हैंड. मदर फादर डॉक्टर है, इसलिए कर रहे हैं, रेज हैंड्स. नो. पेरेंटल प्रेशर, पापा ने कहा पेरेंटल प्रेशर वाले कि यार डॉक्टर बन जाओ, ऐसा था, रेज हैंड्स. अच्छा. मॉनिटरी, पैसा कमाएंगे. How many of you have come because the choice I want to be doctor? Raise hands. Honest. Cheating नहीं. अब कईयों ने हाथ नीचे किए. All right. So monetary, doctors make money is a fact. Correct. All right. Can we learn medicine without slides? हमें कोई slides नहीं चाहिए. Audio visual नहीं चाहिए. How many can raise hands? Nobody. Without teachers, can you learn medicine? Raise hands, yes or no? So they all want teachers. Can you learn medicine without patients?
No.
Those can learn without patients, raise hands. Nobody. So you have to see patients, not merely books. You agree?
Yes, sir.
So raise hands. All those who think that seeing patients is necessary are with me. All right. दो हाथ भी उठा सकते हैं. I saw somebody did it. All right. So now you have to answer honestly. And director sir is not listening. The dean is not listening. And the heads of departments are not seeing it. Is Aiims Guwahati excellent? Raise hands. 20%. Very good. Raise hands. Another 10%. Okay. Raise hands. All right. So more people are with okay. Now, how can I make it the best? All those. All those who said that it is okay, all those who said it is okay, how will you make Aiims Guwahati the best? Is that correct? So you will have to answer in next 1 year, how will you convert the remaining 80% to make Aiims Guwahati excellent? Are you with me? All right. So now the journey starts. So you all, sir, you have a committed group who are all going to make Aiims Guwahati the best. Now it is undergraduate is getting over, and you have the PG. I have made all these for you, undergraduates and then postgraduates. Let's see. Why I show this slide? This is very important in medicine, not in law. It's not important in IT. It is not important in any other branch other than medicine. Never write over your friends, your colleagues. Work with them. So now from UG you are going to PG. Undergraduate, third semester I found that girl, she knows forensic medicine. Where is that lady? Forensic medicine. She said, I am learning forensic medicine. So one of the important things in forensic medicine is to trace कि कहाँ अपराध हुआ, कौन कल्प्रिट है, किसने मारा, क्या सुराग छोड़ा. So please never say, सर उसने IV लगाया था, सर सिस्टर ने दवाई दी थी, इसलिए पेशेंट बिगड़ गया. सर हमने किया. Is that all right for you? That's a very important message I want to give you. And never do this when you are growing to become a doctor. All right. Now, the head of the department or a professor says, the resident who is a second year MD student, have you seen the patient? वो बंदे ने देखा ही नहीं है पेशेंट, इतना काम था, 20 एडमिशन हो गए. What should he say? So you are a second year. Are there some residents, PG students here? Anybody raise hands if you are PG second year, MD, MS? Doesn't matter. So if you are a resident, if not, call them, because all these slides I have for the MD, MS or those who are doing PGs. Suppose you have not seen the patient even in the ward, what will you say? Sir, I have seen the patient? Yes or no? How many will say if you have not seen a patient and you will say, yes, I have seen? Raise hands. Nobody. Guwahati is very honest people. Nobody cheating. All right. So you are with me. If you have not seen, never say, I have seen. Is that all right? Okay. Let's go further. You are a junior consultant. Suppose you are an assistant associate professor and you have been asked by the senior कि भाई उसका एंडोस्कोपी करना, गैस्ट्रोस्कोपी करना, पर गलती से दूसरा पेशेंट आ गया, अटेंडेंट आ गया, पेशेंट की जगह अटेंडेंट की एंडोस्कोपी हो गई. हो जाता है. 600 पेशेंट्स हैं, 500 पेशेंट है, पेशेंट की जगह अटेंडेंट आ जाते हैं, फट एंडोस्कोपी. Now the problem is, what will you tell the patient जिसका नंबर ही नहीं आया, उसको क्या कहोगे? Will you tell him कि भाई तुम्हारी एंडोस्कोपी अब करेंगे? Those who will tell the patient एंडोस्कोपी अब करेंगे, raise hands. You will tell him honestly. What will you tell the guy जिसकी गलत एंडोस्कोपी होगी, उसे क्या कहोगे? कैसे बताओगे कि भैया तू तो आया था अटेंडेंट, तेरी एंडोस्कोपी, उसे क्या कहोगे? गलती से हुई या ये कहोगे नहीं भाई तेरी भी जरूरत थी? दो से तेरे को भी जरूरत थी. और जो ये कहेंगे कि भाई गलती से हो गई, रेज हैंड्स. देयर इज ओनली 1, 2, 3. I would go and tell the patient, भाई गलती से हो. Don't change facts. चलो पेशेंट का तो क्या, बॉस को क्या कहोगे? आप तो सेकेंड ईयर जूनियर कंसल्टेंट हो. अब प्रोफेसर हेड ने बुलाया, यू अंडरस्टैंड हिंदी और नो, या सिर्फ हिंदी?
यस सर, हिंदी सर.
तो अब बॉस को क्या कहोगे कि साहब वो गलत पेशेंट की एंडोस्कोपी की? हाउ विल यू टेल हिम? सच या झूठ? सच बोल दोगे? तो बॉस ने कहा चलो छुट्टी, आज से तुम बर्खास्त हो गए. क्या बोलोगे, सच या झूठ? सच बोलोगे? बता दोगे कि सर गलती हुई है? ऑल राइट, सो यू आर विथ मी. अच्छा, अब आपसे जो जूनियर बंदा है जो गलत पेशेंट को, गलत अटेंडेंट मिला, उसको क्या कर डांटोगे उसे? जो जूनियर को डांटेंगे हाथ उठाओ. सारे लोग डांटेंगे, आधे नहीं डांटे. उसको क्या कहोगे? क्यों लेकर के आया इसको? पता नहीं था, मेरी नौकरी चली गई, ऐसा बोलो. मेडिसिन में एरर्स आर ह्यूमन. You have to try and take him together. भाई जब हो गया, अब इसका ध्यान रखना, अगली बार मत कर. This is the best way. पर अपने आप को क्या कहोगे? एंडोस्कोपी तो आपने की है. How will you punish yourself? क्या करोगे? जब जोर से बोलो, नहीं सुन नहीं आ रहा. What will you do to yourself? Anybody who has the courage to say कि मैं ये अपने साथ करूंगा? Can you see the eye? Can you see the question mark? We never look inside. We always find somebody as a scapegoat. Medicine never find a scapegoat. You are the one who is to be blamed, and make sure you don't do it again. Is that okay? All right for you? Maybe it is my way and not your way. All right. Let's go further. People think residency is a torture. Itna kaam. In my residency days in Aiims Delhi, every night an ambulance will come and every night I would go because I am working on GI bleed. और रोज रात को 2 या 3 bleeders आते थे, and I used to think यार too much work. I would like to tell you, residency is not painful. Residency is not something which you should think that it is a stress. I would say certainly it is an opportunity and it is a formative year of your life. Even till date, I would always, go to the wards at about 6:30. Before that, all the games and swimming. 6:30 we would start and work till 12 or 1, and then the ambulance. So I just want to tell those who are doing residency, if some of them come, consider residency, the workload as a huge formative year. Now this is an everyday problem. Patient आया, रोज 1 बोतल पीता है, पर इंश्योरेंस नहीं मिलती उसको. अगर वो लिखा दे कि साहब आई एम ड्रिंकिंग, he will never get money. फिर से डॉक्टर साहब अल्कोहल मत लिखना. What will you do as a resident or as a doctor? Will you write alcoholic or you will say not alcoholic? What will you do? Those who will say alcoholic, raise hands. Those who will allow and let the patient say no alcohol, what will you do? Those who will not write alcohol, raise hands. Very few. They are knowing me now. Why now? Well, never change your practice of medicine based on the patient, his stature or pressures. Change only the treatment, not the ethics. You must write he was drinking alcohol and mention it. Are you with me on that?
Yes, sir.
There are 6 more questions, not too many. So here is my message. You will not be able to sleep if you do all the time what you want. You should do what you should do. So don't change your practice, don't change the way life is. All right, let's move further. How many of you agree with this? Choose mentor. Choosing a mentor and a mentor choosing a mentee is not easy. So how many of you would like to choose a mentor, except everyone will like to choose Dr. Ashok? How many of you want to choose a mentor? Raise hands. Yes, I like many people. And you become a mentee who is very good so that you are spotted, maybe by Dr. Bhattacharya or the dean or someone. And drinks carefully. Don't think this is alcohol. He is drinking water. You thought he is drinking alcohol?
No, sir.
All of you thought, no? That's why you see it's white. It's not alcohol, it is pure water. Now, this is another problem. Guwahati has 3 medical colleges, am I right? 2 or 3. And several clinics. There's another doctor who is seeing a patient. Let's say he has liver failure. And the attendants come to you and say, सर वो मेरा मरीज वहाँ ठीक नहीं हो रहा है, उसका जॉन्डिस बढ़ रहा है सर, बिल्कुल ध्यान नहीं रखते, तो मर जाएगा, आप क्या ले आऊं? What will be your attitude? This is for faculty. You say हाँ हाँ वो ठीक नहीं चलाता, ये दवाई नहीं, ये बिल्कुल गलत दवाई है, या नहीं एम्स गुवाहाटी बहुत बढ़िया, तुम यहाँ ले आओ, वहाँ ये नहीं है, यहाँ ये है. So the question is, should you transfer in a patient, and this is Jesus Christ. I purposely picked this picture to show you, should I transfer in a patient who is being looked after by others? Suppose there are three options. The patient's relatives say, yes sir, I want to bring him. Second is they say, वहाँ treatment ठीक नहीं हो रहा. Third, you are better than him. So when you will transfer, वो कह रहा है कि you are better than him. Will you transfer on that?
No, sir.
No. Will you transfer if they say वो treatment ठीक नहीं है, यहाँ लाना चाहता हूँ? Yes or no?
No.
No. And you, if the patient's relatives say we want to bring him, will you transfer?
Yes.
Yes. So I just want you to understand, do not transfer or say, I am better, मैंने ज़्यादा पढ़ाई की है, मैं एम्स में काम करता हूँ, उसको नहीं आता. Please, for God's sake, this is something I want to communicate very clearly to you. Now there is another person. उसने सर्जरी की, ऑर्थोपेडिक्स का या कॉक्लियर इम्प्लांट लगाया, इसको डॉक्टर बेंस इज डूइंग दैट. Am I right? कॉक्लियर इम्प्लांट लगाया, not for you but for others, anybody. उसके बाद में कॉम्प्लिकेशन हुई. सपोज फॉर एग्जाम्पल उसका न्यूरोसर्जरी था, ब्लीड हो गया. Will you write every single complication honestly? Yes or no? And how many of you will say, if there is a complication, suppose there is even a death, how many of you will raise and write clearly, this is what happened? Those who will write clearly, raise hands. I see numbers rising slowly. How many of you will find a way so that you don't get caught? Raise hands. I find just nobody. All right, I just wanted to communicate this message to you, yes or no. If you have made a complication, it's part of your treatment. You can justify anywhere. You will say, sir, मैंने किया, but 5% complications are well known. I am a human being. मेरे से 10% हो गया, कोई बात नहीं. I have not done it as an error of judgment. I have done it as part of the natural process. Nobody will put any stigma on you. And the whole community should stand together, but you must write, this is what happened, so the other doctor can possibly treat better. Don't hide, this is my message. I failed is very difficult to accept for doctors. Lawyers तो कभी accept नहीं करेंगे, I failed. But if you accept that I failed, you will leave with a strong mind. Oh, I can handle, even if I fail, I will swim, I can float, I can go back to the seashore. Sorry. Even Jesus Christ fell. It's very well known, he fell down with the cross. To accept failures of students, colleagues with a smile, and your own failure with a look inside, but never, probably in my mind, do it. So see this very famous saying, your best teacher is your last mistake. The mistake, if you hide it, you will never learn. If you commit it, I made a mistake, I will not make it again, and be humble and accept your mistakes. Now this is a very real story. A professor wants to join Imperial College of London. I know there is a lot of hepatitis B, I was told very just now in this part of the world. Am I right, sir? So a professor wants